Shopping online, it's something the pandemic helped make almost universal. People of all ages now expect to be able to look up a product, find a price, and just pay for it.
It's a simple concept, one you think you could expect with every purchase, but just ask anyone who's had a big medical expense lately, and that's not always the case.
THV11's Rolly Hoyt looks into the confusion that still exists when trying to figure out what a medical procedure will cost.
Hey everybody, Ray Knee Jerk here. Sick of getting jerked around trying to get a knee replacement? We're here to help. Our prices for the knees you need are low, low, low.
Imagine if we sold healthcare the same way we sell our other big things in our lives, like cars. The government tried to make it happen, but guess what? Hasn't exactly worked out yet.
Unfortunately, I don't feel like we're very close. I had a mentor that used to say nothing hard is ever easy.
Hospital administrators like Dr. Jerry Jones at CHI St. Vincent have been dealing with a task that sounds easy, but is indeed very hard. At the start of the year, the federal government required hospitals across America to post the prices they charge for popular procedures, and they had to publish the rates they negotiated with insurers. The goal is to give consumers some transparency, a way to price shop among hospitals. Some healthcare providers in other parts of the country have dragged their feet when it comes to complying. Here in Arkansas, the big hospitals have cooperated, but it doesn't mean pricing is much easier to find or understand.
We're inching towards that price transparency, but we're still not there yet.
Kartika Amin is a policy expert with the Kaiser Family Foundation. That's a big healthcare research organization. We wanted to download the so-called menus of the three big local hospitals, UAMS, Baptist Health, and CHI St. Vincent, and try to comparison shop for a knee replacement. As Amin points out, it's not exactly picking a value combo from a fast food joint.
What we had found is that hospitals were posting these codes and the payment rates in all sorts of different formats.
We're talking hundreds of rows on a spreadsheet and dozens of columns. An intrepid knee shopper is going to need to have Google open to translate all the medical terms. A knee replacement is called an arthroplasty. So let's get the price for UAMS. That's item 466, revision of hip or knee replacement with MCC. That's major complications or comorbidities. The price, $72,007. All right, let's check out Baptist now. Their item 466, look across there, $122,301. These are just averages. You could maybe look in the column to find your insurance deal, but that's even more complicated. And it's one of the reasons that the folks at CHI St. Vincent go in a different direction.
Because rather than giving a wide range, which we felt like would confuse people more than answer their questions, we want to give them that place that gets them started.
They provide a cost estimator tool. In other words, to keep the car buying analogy going, it's more like an online dealer like Cars.com, or even more, come on down to the showroom, we'll hook you up. We asked UAMS and Baptist to explain how they arrive at the big difference in their prices. They told us the price lists they provide are just a start, a base model, if you will. Additional costs may come up depending on your individual needs or procedure, adding to the overall bill. But don't think that you can just point at the menu and think that's all you're going to pay. In the end, most experts agree. While being able to see these prices might help you in making a decision, this new push for transparency isn't exactly making healthcare more consumer-friendly.
The price transparency piece can help the market understand what other players are paying, but price transparency isn't in and of itself an end-all to the affordability of healthcare issues that we face as Americans.
And while it might be a step in the right direction, Dr. Jones says there's still a long way to go.
I think it's inevitable that we are going to go back and reassess our healthcare delivery models. How do we pay for healthcare in this country? How do we provide the highest quality healthcare that, quite frankly, we can afford?
In Little Rock, Rolly Hoyt, THV 11 News.
Okay, if you still want to try and price your next hospital visit, don't let us stop you.
We've put the links to the price transparency pages of the three hospitals on our website. You can check it out at thv11.com.